It's 18 minutes to the top of the hour. Shelley Tasker will be with me in a few moments' time. Shelley has made the national media, national news headlines. She is an NHS worker, worked at a hospital in Cornwall. She resigned. She says that the wool is being pulled over our eyes when we are told that hospitals are bursting at the seams and that health workers can't cope with the demand and the stress. Shelley will talk to us in a few minutes' time about that. In the meantime, music from Joan Jett and the Blackhearts. Music from Joan Jett, yeah, I had to double check that. Joan Jett and the Blackhearts and I Love Rock and Roll. Just before we welcome Shelley to the programme, let me read you this from today's Daily Mail. A whistleblower NHS healthcare assistant who publicly resigned after claiming she had no work for 3 weeks at the height of the pandemic has said the claim the NHS is overrun is all lies. A viral Facebook video shows Shelley Tasker, a healthcare assistant at Trellis Hospital, which is part of the Royal Cornwall Hospital's NHS Trust, telling members of the public what is really going on behind closed doors in NHS hospitals. And I'm delighted to say that Shelley has agreed to join the programme today. And I extend a big welcome. Shelley, welcome to the programme. Thanks for coming on.
Thanks for having me.
Good to have you on. How does it feel? I mean, I know you've been talking about this for some time, but you're everywhere today. You're the talk of the town at the Daily Mail and other publications. And I'll tell you something, Shelley, it's very interesting when you read the article. The Daily Mail, to its credit, later on in the piece says that your claims are borne out by the evidence that the Mail has seen. Tell us where all this started. When did you resign and what were you doing in the hospital?
Well, I'm a healthcare assistant there on the bank. So basically I work when I want to and, take on any shifts that I may want to pick up. I was working lots of hours until the pandemic. And as it started approaching and we were waiting for all these deaths, the hospitals were just deadly quiet. We were actually waiting for the big, it was like the calm before the storm.
Yeah.
And I worked a 12-hour shift on a Sunday and there were no patients. And I said, I can't do this anymore because it's soul destroying. Anyway, literally about a week later, us Kernoflex bank workers were told that we had no work. So we had no work for 3 weeks. And then work carried on, but obviously it was a lot different this time because the masks, the PPI and stuff like that. So I carried on working, but not as much. I was on a restriction about 2 months ago because somebody reported me for wearing a mask under my nose. And they've also reported me for organising rallies and organising bus trips to London and stuff. Anyway, I was told that what goes on outside, as long as I'm not implicating the NHS, there's no problem. So I've been careful not to share numbers or anything, just thinking if I am desperate for work, I can go in and do a night shift or something. Anyway, obviously all of this lockdown stuff has been happening this week. And I did a live video just saying all these facts, but my Facebook page isn't public because I've had a lot of hate and harassment the last few weeks.
Where's that coming from, the hate and harassment? Where is it coming from, do you think?
Well, they're local groups near me, people, because I was trying to organise a maskless shopping trip.
Right.
And I was a bit stupid and put it on my timeline. And of course, people were screenshotting it, sharing it. And it was like a massive witch hunt. You learn to get over it, but it was a bit soul destroying, really.
That's what your critics are saying. Your critics are saying that they're saying, oh, Shelley is obviously anti-lockdown. She's obviously anti-mask. Doesn't believe that the measures to tackle COVID are needed, and therefore she's making up these figures to support her claim. That's what your critics are saying. But the media has looked into your claims, and they're correct. I mean, you talk about last Friday, we're told that hospital admissions are going up, the ICUs are rammed, but yet in your hospital last Friday, none of this was true.
No, none of it. There was only 3 patients in with COVID.
3?
Yeah, over 3 hospitals in Cornwall. So basically I took a screenshot and I shared it to a few people. But I'm in an assembly and one of my friends said, do you mind if I take a screenshot and share it? Yeah, that's absolutely fine. I didn't realise that she was going to do the whole post that had my name on it.
Yeah.
Anyway, it doesn't matter because it was all going to come out anyway. Well, then, of course, I had an email from work telling me that, there's been a leak, that I've been sharing confidential information, etc. So there was a rally to be had the next day. So I was thinking, well, I can't lie because it's obvious. It's next to my bloody name,
Yeah.
I can try and lie and say people have had it in for me. But in all honesty, I wouldn't be going back to work anyway. I haven't worked for 2 months because I can't wear a mask. And things aren't going to change. There is plenty of work there at the moment. But it's like, I don't know. I just got to the point I couldn't lie anymore. So if we're going to go out, let's go out with a bang and expose all these numbers. Because I've been getting numbers right from the start. We get emails like every other day. And I started making my own chart. And I got bored towards the end of April because there were, things weren't changing. There wasn't any more deaths and things like that. So I did this screenshot on Friday, I shared it, and then we did a protest in Truro yesterday, and I knew that people were going to be filming it, and I kind of decided the night before, I'm going to publicly announce my resignation. Then they've got no, they can't call me on disciplinary anyway. So I've had a call today, a message, sorry, my email account from the NHS has obviously been closed down. They've sent me a personal email asking me, could I call in to discuss my position? Well, I think it's obvious I haven't got a position anymore. So yeah, I did the speech yesterday, and no, I didn't have a clue how big it would be. It was getting lots of hits yesterday, but today it's been, it's been crazy.
Yeah, I can imagine you'll be getting calls for days and weeks. Go back to this is very important, obviously. What you're telling me today and what you've been telling people when you spoke publicly, we're hearing things like this now from people like Dr. Carol Sikora, World Health Organization. He was on with Julia Hartley-Brewer on Talk Radio today, and they're starting to say this now. They're saying that the data is inaccurate, that we're not seeing any more hospitalizations now than we did in 2017 or 2018, that things are pretty stable. So it's remarkable you coming out. It's very important, I suppose, you having that insider information. Go back, Shelley, please, if you don't mind, to when it all kicked off in April. We were told that the hospitals were overwhelmed. My neighbours were out on the street every Thursday banging their pots and pans and clapping and cheering for the NHS.
The first 2 weeks.
Yeah.
I was for the first 2 weeks because I kept thinking we're all going to die, it's all going to happen, but it just didn't. And it just became apparent then that all the lies that the MSN were sharing and stuff, it was all rubbish.
Right.
And I would just say to people, the hospitals are empty, and they'd be like, no, don't be silly. And I'm like, honestly, it's true.
Shelley, this is really important. Can I just put, this is really important. You know these three hospitals, and you've worked in Trellisk. Do you think, and this is speculation now, I'm a bit cheeky asking you this, but when the hospitals were empty or very quiet in April, May, when they were telling us that they were at bursting point, did you feel that somebody was deliberately giving the public a false account or giving the public a wrong impression? Somebody was working to make the public think that the hospitals were absolutely chock-a-block when in fact they were empty. Is that what was going on?
Yeah, I think it was from the start. I mean, all of this that's going on now, they're just cases because they're testing. They're not, go back to April and May, every day it was a daily death toll being presented on the news, wasn't it? Now it's just how many cases, but they're just testing everyone. And now I think, well, like lots of us think, there's a bigger agenda going on here.
And
why is this happening?
And because most of the cases will be people with no symptoms, asymptomatic people, that means those people will not need to go to hospital. They won't. So you feel that somebody's inflating the numbers to say, well, we're getting 50,000 cases a day. Now we're seeing an increase in hospital admissions, when in fact, okay, if the testing is flawed, and we think the testing is very, very flawed, let's just believe them for a minute that 50,000 people a day are being, diagnosed with COVID. But the fact is, the vast, vast majority of those people are not going anywhere near hospitals. They're not.
I think it's the really vulnerable. I mean, those deaths, I worked it out. There's been 76 deaths over those 3 hospitals in 7 months. So that's about 10 deaths a month. So, and all of those were really vulnerable people. They had cancer. Lots of people get the flu and they die. They get the flu, they get pneumonia, they end up on ventilators. I don't think it's any different. We still keep arguing, is there a virus or is it just a different form of flu? I can't decide or not because I was poorly. I tested positive in an antibody test. But, people are saying that you can test an apple and it will show that you've got COVID. So,
yeah, I had a Swiss doctor. No, not at all. I had a Swiss doctor on here yesterday, a cardiologist, and he did a very good job of explaining why the PCR tests, which are cycled 30, 35, 40 times, why the inventor of the test said you shouldn't do that because it's going to give you a lot of false positives. And we know that they're cycling these tests 35, 40 times. It's crazy that we know this stuff and yet it's carrying on. We've got Shelley Tasker on the line from Cornwall. Until very recently, Shelley was a healthcare assistant based at Trellis Hospital, and she resigned her position because she said, look, I've had no work for 3 weeks when the pandemic was at its worst. And she said that Shelley said that the idea that the NHS is overrun is a lie. It's not. Now, the Daily Mail did back you up, but it did then go on to say that even though you are right, this might be down to the fact that Cornwall hasn't yet seen the brunt of the second wave, which apparently is affecting the Midlands more than anywhere else in the country. So they say you haven't seen the brunt of the second wave. It might get worse, Shelley. What do you say to that?
I think it's rubbish. 76 deaths in 7 months. I don't think we even had a first wave. 76 deaths and you call that a pandemic? I call it very vulnerable elderly people dying of a flu virus. When you compare it to flu numbers, our flu numbers have drastically gone down. And of course, now they're combining COVID deaths with flu deaths.
That's funny. That's funny, isn't it? Yeah, the flu disappearing in certain countries is worrying. And again, it bears scrutiny, doesn't it? But waiting for the media to do that work and to really go after these numbers, we might be waiting a long time. And tell me, and I know you won't name names. I wouldn't ask you to, and I wouldn't want you to. But your colleagues. I mean, how many of your colleagues, would it be fair to say, shared your scepticism about these claims?
I would think a fair few. Lots of people don't. I mean, one person said to me once, she said, I reckon 80% of this hospital know it's all rubbish. That was at Trellis. The other hospitals, one of them, the one where I was reported for wearing my mask under my nose, they're all totally freaked out by it and they just can't see it. They're all so scared. But when you look at the numbers, they've just been scared senseless by the mainstream media. So the problem is there's so many people that believe it. And even now I've come to light and said all of this yesterday. I've got people asking me, am I really an NHS worker? Because obviously I am. It proves that I am telling the truth. People are so confused of what to believe and who to believe because there is so much rubbish going around out there. But actually the mainstream media seem to be the ones causing the rubbish. From day one, they were showing pictures, weren't they, of people falling down in China and stuff.
Yeah.
Well, I've seen anybody do that over here. So, excuse me.
I mean, it's a big decision. I hope you don't. You might be tomorrow. You might be thinking, wish I hadn't done that, because it can be very abusive. I've seen some of the crap that you've had to put up with in the last day or so, and only. I mean, I know it's gone on before that. And, you might think maybe I shouldn't have said anything, but I'm glad you did say something. I think there are signs that some of the national media, the Telegraph for a while now, but even the Times now, we're seeing some of the journalists, Shelley, breaking cover to support people like you, because they've got grandkids, some of these journalists, they've got children. They know what it means for them if we don't stop this lockdown insanity, Shelley, what do we know about the real numbers? I know you've done your homework. Healthcare assistant, Trellis Hospital. What do we know about the numbers? Is it true that the average age of somebody dying is 82? Is that true? Is it true that if you get the virus, 99.7 or 99.8% of those who get it will survive? Are these accurate numbers? Yes, they are. So many people, and there are these drugs that do work as well. I think actually the hospitals
unfortunately, if you've got it, they're not assisting in helping you recover. They're just managing it. I haven't actually worked on the COVID wards. I probably should have done a bit more undercover work before I resigned.
Right, yeah.
But the numbers, I've always said from the start, you do the maths from the World Health Organization and the world population of deaths, it is something like 99.97%, you're immune to it. So we're basically, and why have a vaccination for something that you've got a 0.5% chance of getting anyway?
You'll get absolute dog's abuse on social media now. And by the way, ignore that.
I'm not worried anymore. I've kept my page private now.
Yeah. I say that because I've, not as much as many people, but anybody who does radio like this, you get a lot of that and you get used to it very quickly and you realise you laugh. The only opinions that matter and should matter to you are the opinions of the people you love. Everybody else, to hell with them. But the reason I brought it up was because you'll be labelled now as anti-vaccine. And they'll say, oh, there you are now. There's a healthcare worker, NHS lady, and all she was ultimately was an anti-vaxxer. You'll be accused of that. Are you an anti-vaxxer?
I am, most definitely. I've got a 7-year-old who's had no vaccinations. So, and he's very healthy.
Was that easy? Was that easy to do? I ask you this because friends of ours and people we know and listeners, they have recently had children, they're expecting children, and they don't want to vaccinate. They want the child to develop a natural immune system. And I think as the parents, I think they should have that bloody right. I believe that. But they're worried about getting a knock on the door, Shelley, from somebody, from a busybody.
Yeah, they can't do anything. It's your choice. At the moment, it's still your choice.
Yeah.
I had to go in and see the doctor and explain. I mean, I was the one giving him the ingredients of a vaccine. He laughed at me when I told them what, I think doctors get something like 10 hours training on vaccinations.
That's true.
Yeah.
I can
So
confirm that.
at the end of the day, you have to make an informed choice. I think if you do all the research and stuff, you just kind of what feels best for you. I had my first 2 children vaccinated because I didn't know any different. It's like, right, take them in. Yeah, okay, doctor knows best. And then with my last one, he's 7 now. Like I said, we went to talks. We made an informed decision, and I believe we made the right decision.
And did he get the mumps and the measles and the chicken pox? Did he get all of that?
He hasn't had any of it.
He's had none of it.
Oh, sorry, he did have chicken pox. Yes, he had chicken pox.
So what? Let me be the devil's advocate then, because if I don't, I'll be shot for not doing my job. So if there's a pro-vaccine person listening and they say, there you are now, Shelley, sounds good, yeah, he's lovely, he only had chicken pox. What if he gets the measles when he's in his 40s or 50s? Might be a bad thing then. It might be very bad.
It could be, but do you know what? I haven't thought about when he's 40 or 50. I just think about when you do have the measles, usually the measles actually comes out is the result of having the virus. So if you get to that stage of having all the spots, you've gone through the virus. So you're over the worst of it, in theory. I think that's right.
Yeah.
And we used to have measles parties, didn't they?
They did. Tell me about it. I'm 45. We were thrown on top of children that had measles.
I had the measles when I was a child.
Yeah.
So I think, they're all common problems, but they should be promoting health, not vaccinations and stuff. If you look after yourself, then if you was to catch these diseases, viruses, then you'll be fine. That's my personal opinion anyway. Which
you're entitled to, absolutely, by all means.
Yeah.
Shelley Tasker is our guest. We'll stay with Shelley for another few minutes because there are some interesting tweets. Shelley is, national news attention today because as an NHS healthcare worker working in Cornwall, Shelley resigned her position and she said, look, I've got to do that because people are being told lies about the seriousness of the pandemic and about hospitals being overrun. And the article in the Mail, I think, is pretty fair. And they did their homework and they confirmed that Shelley was telling the truth about last Friday with only 3 COVID patients across 3 hospitals. None of your hospitals down there, none of them had any of these TikTok videos, did they, of sexy dancing doctors? Any of that nonsense, Shelley, no?
No, I don't think so. But that does explain, doesn't it, all the TikTok videos. How on earth did they have time to make those?
Yes, the mind boggles. I looked at some of these earlier on, elaborate productions. Spielberg would have been proud of some of these things. And I thought to myself, how could they be up to their necks? And I mean, with stress, imagine people are dying, worried that you might get it yourself and give it to your I don't know, to your family? How could you find time to do, I don't know, a scene from Dirty Dancing, but yet they found the time to do it?
Well, this thing, I mean, at the start, I was petrified. I thought we were all going to die. I had awful anxiety for a few days, and then it was like, no, it's not taking over my life. I'm going to live. You can catch any virus, and like we say, lots of people probably had it, and they don't know they've had it. I don't believe it to be any different than the flu. And if you think a vulnerable person, they'll catch the flu and they will die. I don't think it's any different.
Yeah.
Some people shoot me for that. I'm not a viral. Oh, what's the word? A virus.
A virologist, yeah.
Yeah, I'm not a virologist or anything, but I've done my research and it fits with what I believe. So, and what I've seen, the hospitals are empty, and I was at that point. I'm never going to be going back anyway. It's kind of a sign, because in London a couple of weeks ago when I did a march, I lost my NHS badge and my blue light badge out on the street somewhere. It was a sign then. I was never going back. But like I said, it was nice to think I can sneak in and do a night shift if I get really, if I really need the money. But I trust the universe will provide, and I'm not going to go without anything. So, yeah.
Acting on your conscience is commendable, Shelley. Really. I mean, I can imagine you being there and reading these horror stories and looking around and thinking, what the hell am I reading? And, how could you not but say something then? But most don't. We need more people like yourself, whether it be healthcare workers like yourself, whether it be consultant surgeons, whether it be somebody working in a canteen. People have to do it because the alternative is a technocratic, dystopian, lunatic asylum of a world where we are told we can't go anywhere. I mean, I don't know if you're aware of Slovakia. In Slovakia, they're testing everybody in the country regularly and giving them pass certificates, an actual piece of paper. And if you pass, you can take your certificate to the local restaurant, or you can go to work. I don't want to live in a world like that, Shelley.
No, I don't. I don't want my children to neither. So we have got to stand up. And my saying is, there's too many fannies out there. I'm sorry.
Yeah, fair enough.
They're masks and they're living in fear, and you can say things to them till you're blue in their face, but no, the mainstream media, why would their government lie to them? They can't understand, they're being told the truth. So, and the good old government has got their best interests at heart. So our whole county is closed down because there are 3 people with COVID in a hospital.
And everybody is told don't go to work except the furlough money, which must be paid back later on. It's insane, isn't it?
It's an absolute joke. And I mean, one of my friend's her mum committed suicide about 2 months ago. And so many people are struggling. And it's just going to get a whole lot worse, because there's people believing that they have to stay in. I've had a couple of people message me and like, what do you think I should do? We can't stay in. It's going to kill us, another lockdown. It's like, you have to carry on as normal. But they're so scared of fines and things. And once you get over that fear, you are fine. We were threatened with a protester a few weeks ago. It was like, well, you could get a £10,000 fine. Well, yeah, bring it on. When it will go to court, it will get thrown out.
Of course it will.
Not doing anything illegal.
And who's got 10 grand anyway? I love it. You can
exactly.
They do it to Piers Corbyn, and I've known Piers for years. He's a lovely gentleman, and I know that Piers hasn't got a pot to piss in. I know he hasn't. The weather website barely wipes its face every month, and he just laughs. The idea that he'll have to pay £10,000 is ludicrous. People need to be brave. Shelley Tasker is our guest. Just before we go, Shelley, there is something nice happening. My studio is very well soundproofed, but all of the neighbours are having a party. There are fireworks going off in the background, which is a bad thing for the animals, and I don't like it because we've got animals. But at the same time, I'm thinking, go on, lads, fair play to you. You know what I mean? Yeah, how dare they tell you can't have a bonfire on Guy Fawkes night?
You can't do anything.
Yeah, exactly right. Shelley's been incredibly courageous. Resigned her position as a healthcare assistant. Worked at Trelisk Hospital in Cornwall, and she's gone public and said, "Listen, they've not been telling the truth about the extent of the hospital admissions. Their claims that it's overrun, those claims are incorrect, and I've got to speak out." And I think that's commendable. Just ignore. The mute button on Twitter and the mute button. It's a wonderful thing. When people start swearing, just mute them. Do you know why it's wonderful, Shelley? Because they'll carry on for weeks. They'll carry on for weeks.
I know.
It's fabulous.
They're dragging up every bit of dirt about me they can.
Nah. But, anyway,
let them do it. If they're that sad and they've got nothing better to do, then it's just unbelievable, really. But yeah, it's like a water off a duck's back, to be honest with you now. You just have to focus on actually all the people that have sent lovely messages and been really kind, and there's been loads of them. So
well, there's been lots. I've been reading them as well. Final question then. Presumably, it's a decision that was made with your children at the forefront of your mind, because they're going to have to. I'm 45 now. Please God, I'll live another 30 years. I've had a good run anyway, you know, if I die tomorrow. But it's for them, right, that you're coming out and speaking out.
Of course it is. Everything I do is for them. And how can we live like this now? You feel like you're in the film The Matrix when you go out and everybody's in their masks and stuff. And when is it going to change? People have got to start speaking up and making changes. I mean, I understand. I've got a couple of other people that work in hospitals, and they said if they didn't need their job, they would speak up as well. People know what's going on, but unfortunately, you know, they're tied in the system. They want their jobs, and you know, they've got families to look after and stuff. And perhaps if I didn't have a partner that had a good job and stuff, I'd be a little bit more worried. But like I say, I'll just sell some stuff on eBay. You know, we'd be fine. We have to get over this materialistic world of why we're actually working anyway.
Yeah.
Too much of what we've got and not enough of, you know, what's on the inside, which is all that matters, actually.
We're the only species of animal on planet Earth that must pay a fellow member of our species for the right to a life.
Yeah, exactly.
That boggles my mind from time to time. You look at, you know, you go out with the dogs, you go out, you see all manner of creatures, and you think, we're the only idiots on the planet that, you know, that coerce one another into doing jobs that we hate in return for the right to have a roof over your head. Yeah, it staggers me at times. Shelley, I think you're great. There's no point in me giving people any details of where they can find you online. You're going to lie low for a few days, I'm guessing. but no, I'm really impressed with you for doing that. I really am.
Thank you very much.
And anytime you want to come back, if there's any updates, do drop us a line. It's been a pleasure having you on the programme today.
It's a privilege, because I actually run a radio show weekly as well.
Oh, shit, Shelley, shit. That's on me notes. Excuse me. Oh, thank God. Thank God you mentioned that. If I didn't give that a plug, I'd be a right bastard, as we say in the old country. Yes, tell us about the radio. Go on.
Well, it's just I've been doing it for the last couple of months. I've had some good guests on. I've had Piers Morgan on. I've had Gazer Terriani, some big names and stuff.
You have?
I'm doing weekly chats. It's me, myself, and my friend Charlie Rainbow and Nina Eilertson. We just do it every Wednesday at 8:30, and we just try and have a topic each week. Somebody speaking about common law. We've had people talking about vaccinations.
Brilliant.
Just a general chat show, really. So
Wednesday at 8:30, you said. How do people find this now?
It's on my Facebook page. It's called the Shelley Tasker Show.
I'm glad you're on at 8:30. You're not competing with me. I like that. That's good. That's good.
Well, you're a pretty big man, aren't you? And I mean,
I'm tall. I'm not big. I'm tall. We're all big in our heads, I think. No, I'm a tall bloke, but I'm not that big. No, that's great. The Shelley Tasker Show, and Shelley is SHELLEY. And there's only, if you look for you on Facebook, which my mate Raj did today, you'll find you pretty quickly. And you're being a bit careful about who you're letting on there, which is good. But I'll be listening next Wednesday at 8:30, guaranteed.
Yeah, wonderful. Okay.
Thanks for coming on, Shelley. Great work.
You're welcome.
And all the best. Godspeed to you. Cheers. That was lovely, wasn't it? Shelley Tasker, 8:30 Wednesdays, the Shelley Tasker Show. Healthcare assistant, pissed off at hearing about horror stories about overflowing hospitals and beds. Looked around at the hospital she worked at in Cornwall and said, this isn't happening. Knows about other hospitals, says this isn't happening. Went public and resigned her position, and well done to her for doing that. Thank you to Shelley. Thanks to Jackie Devi, my great pal, on In Air 1, and the irrepressible Gerald Salente, trendsresearch.com, who joined us, of course, just before Shelley. That's it for the week. I'll talk to you on Sunday. Until then, have a fantastic weekend. Fireworks are going off. It's like, I don't know, a war zone out there in Salford this evening. Thanks for your company. And you know I mean it when I say take care of yourselves and one another. Going out with the Saw Doctors. Bye.